Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the Matterhorn trial, transcatheter repair versus surgery for secondary mitral regurgitation. Jane, at the end of a busy day for you, we have a second study of transcatheter MV repair presented back-to-back. What did these researchers want to know?
So in this study, the Matterhorn trial, the investigators asked the question whether transcatheter mitral valve repair or transcatheter edge-to-edge repair for patients who had secondary mitral regurgitation was non-inferior to surgery. So either mitral valve repair or mitral valve replacement for those patients who had heart failure secondary to mitral regurgitation.
And Eric, how did the investigators look at this question?
They performed a non-inferiority study in which they randomized patients with heart failure and secondary mitral regurgitation who are failing medical therapy to either transcatheter repair or surgical repair or replacement of their mitral valve. The primary outcome was again a composite, this time of death, heart failure hospitalization, reintervention on the mitral valve, assist device implantation, or stroke 1 year after the procedure. They randomized more than 200 patients. They found that more than 16% of patients in the transcatheter repair group and more than 22% in the surgery group reached the primary endpoint. These values met their criteria for non-inferiority. There were fewer safety outcomes after transcatheter repair.
So Jane, how do you apply these results to patients with heart failure and secondary mitral regurgitation?
Well, this is actually encouraging data that shows us that the transcatheter edge-to-edge repair, which is a percutaneous procedure, is actually non-inferior to surgical procedures. And we didn't know this beforehand. So how do we use this in everyday clinical practice? Well, this is where the heart team should come in and the discussion should be made to figure out what is really the best procedure for the patient. And if it's transcatheter edge-to-edge repair, at least we know that for up to 1 year, that procedure is non-inferior to surgery with respect to this composite of death, heart failure, hospitalization, reintervention requiring an assist device, or stroke.
Jane, this is a non-inferiority study, but this is the way that things started out with TAVI, which looked good when it started. And in fact, it really is probably the first choice procedure for many patients. So is transcatheter mitral valve repair also going to end up being a first choice procedure in a substantial number of patients?
That's a great question. This can be a tough procedure to perform given the patient's anatomy. And this is one, again, where it will be a heart team decision, but as more and more procedures are performed, whether or not the patient goes to transcatheter repair versus surgical repair, the pendulum may swing. That remains to be determined.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.